Mental Health America has just released a report on the state of our mental health due to the illness. The State of Mental Health in America report is designed to create a complete picture of mental health throughout the U.S. In 2015, when this initiative was created, we did not anticipate that there would be a population-level health crisis that would change the landscape of mental health in every community throughout the U.S., with effects for years to come. The illness has affected the entire population of the country. While the risk of contracting the disease itself is a population-wide traumatizing event, our physical and social environments have changed as well, leading to greater rates of isolation, loneliness, financial hardship, housing and food insecurity, and interpersonal violence. Any of these factors by themselves can negatively affect the mental health of individuals, but in combination they have created a nationwide mental health crisis. From January to September 2020, 1.5 million people took a screen and accessed immediate resources and supports through the MHA online screening program. The number of people looking for help with anxiety and depression has skyrocketed. From January to September 2020, 315,220 people took the anxiety screen, 93% increase over the 2019 total. So anxiety is almost doubled. 534,784 people took the depression screen, an increase of 62% over last year. The number of people screening with moderate to severe symptoms of depression and anxiety has continued to increase throughout 2020 and remains higher than rates prior to the illness. So what they're saying there is that anxiety and depression just continues to keep getting worse and worse throughout 2020. In January, it was 71%, February 74%, March 76%, and then in June it jumped back up to 77% and getting higher again. July 79%, August 79%, September 80%. And the same is true for severe depression. In January and February it was around 80%. Now it is at 85%. More people are reporting frequent thoughts of suicide and self-harm than have ever been recorded in the MHA screening program since its launch in 2014. Since the illness began to spread rapidly in March, over 178,000 people have reported frequent suicidal ideation. 37% of people reported having thoughts of suicide, more than half or nearly every day in September 2020. Rates of suicidal ideation are highest among youth. Not only are the number of youth searching for help with their mental health increasing, but throughout the illness, youth ages 11 to 17 have been more likely than any other age group to score for moderate to severe symptoms of anxiety and depression. This graph shows that the percentage of screeners to the mental health screening are getting younger and younger. The 11 to 17 year demographic has jumped to almost 40%, and it was just under 30% last year. In September 2020, over half of 11 to 17-year-olds reported having thoughts of suicide or self-harm, more than half or nearly every day of the previous 2 weeks. From January to September, 77,470 youth reported experiencing frequent suicidal ideation. From March to September, over 80% of 11 to 17-year-olds who took an anxiety screen scored for moderate to severe anxiety. And you can see with time, it's getting worse. Schools should have been opened by August or September, and that's when depression or the anxiety has been at its worst. People screening at risk for mental health conditions are struggling most with loneliness or isolation. So from April to September, among people who screened with moderate to severe symptoms of anxiety or depression, 70% reported that one of the top 3 things contributing to their mental health concerns was loneliness or isolation. So that's what we've been saying this whole time. The hidden impacts of all these lockdowns was in how it impacted our mental health. 70% of those struggling with mental health are now ranking loneliness and isolation at the top of their lists. I bet a lack of work, money issues, stress is also up there. In April 2020, MHA added the question, thinking about your mental health test, what are the main things contributing to your mental health problems right now? And choose up to 3. So they're asked to rank what they think is attributing to your mental health issues, and you would rank your top 3. 70% are saying that it's loneliness or isolation, and that's the number 1 response. Number 2 response is past trauma at 46%. Third is relationship problems at 42%. Then you've got a near tie with the illness, current events like news and politics, and also financial problems. And racism is the lowest at only 7%. Here's where they compare states from last year to this year. But states that didn't lock down tended to do better. Like look at Nebraska. Its overall ranking last year was 23. Now it's 20. Montana last year was 43. Now it's 30. South Dakota last year was 24. Now it's 16. Texas last year was 38. Now it's 27. Tennessee last year was 39. Now it's 28. So there definitely was improvements in terms of the rankings for states that didn't lock down, but I'm pretty sure that in every state, the rates of anxiety and depression have gone up. With the United States looking like it's heading into lockdown again and the winter months approaching, we're going to hit a collision of lockdown depression with seasonal affective disorder. These are 2 horrible things that are happening at the same time. Here would be the ranking of adults with serious thoughts of suicide. The percentage of adults reporting serious thoughts of suicide is 4.3%. The estimated number of adults with serious suicidal thoughts is over 10.7 million, an increase of over 460,000 people from last year's data set. Here we have a graph, youth with severe major depressive episode, ranked by states. As it gets darker, it's getting worse. It says 9.7% of youth, which represents 2.3 million youth, cope with severe major depression. The number of youths experiencing severe MDE has increased by 126,000 from last year's data set. So you have to add this number, the 126,000 youth that now suffer severe major depression, with the 460,000 additional adults that think of suicide. And we're getting larger and larger numbers of people with either depressive thoughts, depressive episodes, anxiety. Here is a question on their screening. Over the last 2 weeks, how often have you been bothered thoughts that you would be better off dead or of hurting yourself? In 2020, the number and rate of people reporting frequent suicidal ideation has reached the highest level ever recorded. So each of these lines represents a different year. 2015 is in orange, 2016 is in red, 2017 is blue, and you can see 2020 is green. Up till about May, we can see that they're all tracking between 29 and 33%. But 2020, since then, has just gone crazy. And we started in January, 17% thought about it nearly every day. Now that's 22%. It was 13% of the respondents saying that it was more than half the days. Now that's at 15%. As with rates of anxiety and depression, youth ages 11 to 17 report the highest rates of suicidal ideation of any age group. In September 2020, 51% of 11 to 17-year-olds reported having thoughts of suicide or self-harm more than half or nearly every day of the previous 2 weeks. From January to September 2020, 77,470 youth reported experiencing frequent suicidal ideation, including 75,107 since the beginning of the illness in March. So here they break that down for you in just basically the last graph, but only those that are 11 to 17, and you can see that the increase over time is actually just much more pronounced. Here's the depression statistics broken down by race. And as you can see, we're all impacted, going up for each category. Here's the rankings by state. They ranked all 50 states plus the District of Columbia. The lower the rank, the lower the prevalence of mental illness. And in rank, you can see here on the very right, Vermont, Pennsylvania, Massachusetts, Maryland, New Jersey, New York, Minnesota, Hawaii, District of Columbia, Delaware, Ohio, Rhode Island, Connecticut, Maine, Michigan were the lowest 15. And the worst 15 in rank 51 was Nevada. Then in 50 was Idaho, Alaska, Oregon, Colorado, Utah, Oklahoma, Wyoming, South Carolina, Arkansas, North Carolina, Arizona, West Virginia, Missouri, Georgia, Alabama. Here's a graph of the United States indicating the adults with any mental illness. As it gets darker, the prevalence is getting worse. Here is the ranking of adults with substance use disorder in the past year. As it gets darker, it's getting worse. The unfortunate thing about all this is that it's the youth that are not getting treatment. Here in this section, it says youth with severe MDE who received some consistent treatment, and only 27.3% of youth are receiving some consistent treatment. Consistent treatment is determined if a youth visits a specialty outpatient mental health service, including a day treatment facility, mental health clinic, private therapist, or in-home therapist more than 7 times in the previous year. The biggest issue is cost. Either you have no insurance and are unable to afford it, or you have private insurance, but that doesn't cover mental or emotional issues.